Andrew Yang is accusing Democrats of having the, quote, wrong conversation on health care. The presidential hopeful recently released his platform, which focuses on prescription drug costs, modernizing services, and diminishing the influence of lobbyists. He calls his proposals a statement on the critical failings of the current system and viable paths to solve them. Here via Skype to weigh in on Yang's plan is Wendell Potter, former healthcare executive and leader of the Medicare for All Now PAC. Great to see you, Wendell.
Thank you very much, Krystal. Good to be here.
So Yang says that he still supports Medicare for all in spirit, but what he seems to have put out is a much more limited set of reforms. What's your reaction to his plan?
Well, my reaction is just far too limited. I mean, I don't think you can dispute or argue with what he is proposing. They're all notable. One thing that I found fairly peculiar, and I don't know exactly how he would do this. He's proposing that physicians be paid a salary rather than on a fee-for-service basis, and it's not clear, at least from what I've read so far, who would actually be paying that salary. Overall, I think his points have merit. He's saying that we need to have some action to reduce the cost of prescription drugs, and there's a lot of activity in Congress right now to try to do that. It's not an easy thing to do, and certainly Medicare for All, when it's implemented, will have a real power to reduce the cost of prescription drugs. One of the things that I saw missing was any effort to control the cost of hospital care, which actually eats up more of our healthcare dollars than anything else. And he also is suggesting that we can make progress on getting people covered, which is important. We need to get to universal coverage, and that's long been a goal of Democrats. 10 years ago, that was almost their sole focus, and we got several million people covered who had been uninsured for a long time previously. But we've got a long way to go. The problem with just focusing on that is that we're ignoring the real problems that middle income earners are facing increasingly. People with health insurance are often unable to pay for the care that they need because they're in high deductible plans. And the structure of the system is what needs to be changed. It's not just tinkering around the edges, which is exactly what Yang's plan seems to do.
If I were to channel him, I think what he would say in response is essentially, these are reforms that I think we could actually get passed. These are things that I could see us getting through Congress or that I could do with executive authority. So this is a pragmatic path forward rather than that more structural change that you would advocate for. What's your response to that argument?
Well, we just don't have time for small thinking like that. We've got a crisis in our country in health care, and we've tried the small things. The Affordable Care Act was big legislation. It was a big move forward. But I said at the time that it was the end of the beginning of reform. We have healthcare costs that are completely out of control. I was doing some research and noticed that in 1993, the cost of a family health insurance plan through the workplace was $463. It is now $20,500 on average. And that's just astonishing how fast that has grown. And of course, that's just the cost of health insurance. The cost of health care on the delivery side has been growing at an equally fast clip. So we don't have time to just say, this is what is pragmatic, this is what I might be able to pull off. You've got to have someone in the White House who really is bold and will recognize what we need to do and lead the nation, not just follow the polls and say, here's what I think we might be able to pull off. It's just not leadership in my view.
What is causing those insane prices that Americans pay for health care versus the rest of the world? I mean, is it really the sort of profit motive and structure of our system that's driving that?
It absolutely is a profit motive. And the structure, the underlying structure, is unlike any other in the world, and we're paying the price for it, literally and figuratively. The reality is that we have multiple private health insurance companies that most of them now these days are for profit. Their singular goal is to enhance shareholder value, to make as much money as possible, and they're doing quite well at that. What they cannot do is control healthcare cost. It's just structurally impossible the way that we have a system for private insurance companies to do that. as long as you have insurance companies so supposedly competing for business, none of them is big enough to really negotiate favorably with big hospital companies or drug companies. It's just not possible. The other thing is they don't really want to at the end of the day, because as healthcare prices go up on the delivery side, they're able to increase premiums to more than offset the increase in healthcare costs on the delivery side. So we're all paying for that. That's why you've seen these incredible increases in health insurance premiums over the years. We just can't afford it anymore.
Yeah, it's a system that seems to be designed to benefit everyone except for the American healthcare consumer. Wendell, it's always great to have your expertise. Thank you so much.
Thank you, Krystal.
Well, more Rising for you after this.